Well, hello everyone. My name is Dvortcsak, and I am a speech language pathologist and autism specialist in Portland, Oregon. And Brooke and I are here today. I'll let her do her introduction, but we are the developers of Project Impact, which is a parent-mediated intervention. And we are here today to talk to you about coaching via telehealth. So I know right now, given the current crisis, my practice had to switch from all in-person sessions to telehealth sessions rather rapidly. And so we've been receiving requests on how can we set up an effective model to continue to provide services to families and children with social communication challenges. And I think that given all the stressors, and we've all had disruptions in our life, many of us at home with our children, trying to set up the schedules, it's now more important than ever that people can have access to services. So our hope by doing this talk was to share some information that will hopefully allow you to continue that important work with all of your clients so they can get access to services at this time. Now I will turn it over to Brooke.
Yes, thank you. As Anna mentioned, we've worked together for the last probably close to 20 years now, developing parent-mediated interventions for young children with ASD. And over the last about 7 years, my research lab at Michigan State University has been examining ways to translate the in-person model to a telehealth model. So we have quite a bit of experience from a research perspective as well, doing this type of parent coaching over the internet. So what we are planning on talking about today is not a specific model, not a specific parent coaching model, but rather the broader process of being able to deliver coaching over the internet. And for the purposes of this webinar, I just wanted to give you a few just little bits of information. One is we are recording the webinar and we will host it on YouTube when it's done. And we will send out an email to all of you who've registered with a link, as well as with links to some of the materials we discuss actually in the webinar. So you will get access to this, and you're welcome to share with your colleagues. The other thing I was going to mention is we have some of our staff with us today who will be able to answer questions as we go. So we encourage you to use the Q&A function on the Zoom as opposed to putting questions in chat, and they will respond to the questions, the Q&A, and post them so that everybody can see them. And just one other thing about webinars, since many of you might be starting to get very familiar with Zoom right now, is the webinar function sets it up so that you do not have the ability to, your microphone is automatically off and your camera is off. So if you are having questions about whether anyone's seeing you or not, they're not, just because we're using the webinar function. Okay, so I'm going to go ahead and get started. I'm going to do a screen share really quickly and get that going. All right. Hopefully everyone can see my my screen. And you can do this, and then I have the option for that, and I'll move this over here. Okay. So there we go. Thank you. So just to give you a really brief overview of what we're going to discuss today, we're going to start with a brief overview of parent-mediated intervention in general and telehealth coaching models that have been used to deliver parent-mediated intervention remotely. Then we're going to spend a little bit of time talking about how to prepare your practice to be able to do telehealth-based parent coaching. Then we're going to spend some time talking about how do we set up families for success with telehealth coaching, particularly if you're shifting midstream from a more direct intervention model to a telehealth coaching model. And then we're going to spend some time talking about how to provide parent coaching over telehealth. How do you actually specifically deliver the coaching remotely? And before I get started, I wanted to talk a little bit about parent-mediated intervention so that we're all on the same page when we talk about how we're going to deliver parent-mediated intervention via telehealth. So when we're talking about parent-mediated intervention, we're talking about a specific form of intervention that involves systematic instruction and strategies that are designed to help parents accomplish specific goals or outcomes for their child. And we see the use of parent-mediated intervention in a wide variety of disciplines who serve children with autism and related developmental disabilities, as well as children with other psychological challenges. And when we look across the broad literature on parent-mediated intervention, which is also sometimes referred to as parent training, we see programs tend to focus on one or more of the following three areas. The first is to really focus on improving parent-child interactions. The second is to help children learn specific developmental skills. So this might be, particularly if we're thinking about serving children with autism, we might be focusing on teaching social communication, for example. But we might also be focusing on teaching things like self-care, independent skills. And then finally, we see a broad range of literature that's focused on helping parents manage their child's challenging behavior. So if we look across all of these types of programs, we see that there have been well-developed parent-mediated intervention models to address each of these areas, and some intervention models that address more than one. I do want to emphasize that when we look at the literature on best practices, parent-mediated intervention is considered an essential component of a comprehensive intervention program for young children with ASD, as well as children with other developmental disorders and delays. But parent-mediated intervention can also be considered a primary intervention strategy. And we do a lot of work on parent-mediated intervention, particularly for young children with ASD, where it may be the primary intervention. But now that we're in the middle of this particular COVID pandemic, many of you are being faced with this aspect of having to switch from a more comprehensive intervention model where you're delivering services directly to having to do services remotely. And in many cases, particularly for young children with ASD or developmental delays, or for children that have some more significant impairments, you really need to have someone there directly with the child helping them learn. And thus, parent coaching may be the only appropriate model for delivery over telehealth remotely at the moment. So when we think about parent-mediated intervention, we're really talking about a shift in practice. And so for those of you who've been predominantly doing more direct intervention models where you are the primary intervention provider to moving into a parent-mediated intervention model, there is going to be a significant shift in the whole process of intervention. We're shifting from an expert delivery model where the provider is the expert and delivering the intervention to a partnership with the parent, where the parent actually brings in a shared expertise. The goal of the process is for the provider to really help the parent develop skills and competence to change their behavior in order to achieve those developmental or behavioral goals for their child. So the relationship and the roles in a parent-mediated intervention, the provider's role is really to collaborate with the parent to develop goals for the child based on what the parent's needs and wants are, and then help the parent learn and use strategies with their child to address those goals. The parent's role is then to use those strategies during daily routines and interactions with their child. And so when we kind of shift to this parent-mediated intervention process, the way in which we develop goals and the way in which we work on achieving those goals with children may look very different. When we look at what the research is on parent-mediated intervention in ASD, and we're focusing specifically on ASD for this talk because this is the area that Anna and I have worked in for a long time, but a lot of this work actually is much more broad than ASD. It certainly applies to children with developmental delays more broadly, as well as children with other behavioral concerns. But when we look at the literature specifically in ASD, we actually see a number of benefits of parent-mediated intervention models. We see, particularly when we're looking at children, we see improvements in skills, and a lot of parent-mediated interventions in ASD have really focused on improving social communication, and we see gains in social communication skills in children in response to parent-mediated interventions that focus on this. We also see programs that have shown effects on adaptive skills, such as self-care, independent skills, as well as behavior management. Another real benefit of parent-mediated intervention when it comes to child outcomes is that we've seen that generalization and maintenance of child skills is actually better when the parent has been taught how to carry out those strategies on their own, as opposed to just direct intervention models. So there does seem to be broader benefits of including the parent in the process on child skills. And we also know that it's time and cost effective. It requires fewer hours of provider time to be able to achieve the same outcomes for children, because the parent is being able to carry out those strategies throughout the child's day. We also want to look more broadly and see what are the benefits on the family, because we're actually including the family in this process. And when we look at family outcomes, we actually see a number of additional benefits. So we see increased parent self-efficacy. So parents that have been taught to use these intervention strategies with their children feel much more competent in their ability to parent their child. We also see related reductions in parenting stress and more positive family interactions in general. So there are a number of benefits of parent-mediated intervention, specifically in the treatment of children with ASD and related concerns. And when we look at the research base, we see that people have pulled together, a number of different technical review panels have pulled together the research evidence for parent-mediated intervention in the treatment of ASD. And parent-mediated intervention, or parent training, parent-implemented intervention, is considered an evidence-based practice by a variety of technical review panels. So I just wanted to pause here for 1 second, and actually I'm going to propose a poll just to get an idea of sort of who is our audience, and sort of to make sure that we're tailoring this correctly. I'm curious, let's see how this, if you could indicate the extent that you've provided parent coaching before in the delivery of services for children with ASD or related concerns. And I will go ahead and share that poll once everyone has had a chance to vote. Okay. So I'm going to go ahead and end polling and share the results. And what I see here is that the vast majority of those of you who are attending here have done some form of parent-mediated intervention before. So when you're thinking about shifting to a telehealth-based model, you're basically going to be thinking about shifting the in-person parent coaching that you're likely to be doing to a telehealth-based model. But there's a portion of you as well that haven't really done much parent-mediated intervention before. So you'll also be thinking about how do we do parent-mediated intervention at the same time you'll be thinking about shifting to telehealth. So there will be a number of different supports available out there for you, and we do refer throughout the workshop and in some links that we'll provide at the end to some additional resources that can help you make that shift in your practice. Okay, so when we think about parent-mediated interventions, we see that across a wide variety of these interventions, there are some specific similarities, regardless of whether they're focused on increasing child skills, building developmental skills, helping the parent-child interaction, or managing child behavior. Across the various types of parent-mediated interventions we see, there are some key elements that kind of separate out those that are effective from ones that maybe have less of an evidence base. First, there is collaborative goal setting, which means the provider and the parent work together to decide the goals for the child. Then there's systematic instruction, which means that the specific strategies that the parent is going to be taught are taught in a very systematic way, in a step-by-step manner, in a sequenced curriculum. Another key element is parent practice and feedback, and we actually have quite a bit of information to suggest that parent practice and feedback is probably the most important aspect of parent-mediated interventions for increasing parent skill. And then finally, there's ongoing support and problem solving. So what I want us to keep in mind when we're talking about parent-mediated intervention, we're keeping these 4 components there, whether it's delivered in person, in a group, or over telehealth. So now I'm going to shift really briefly to talk a little bit about some of the types of different telehealth service delivery models that are used in order to provide some level of parent learning or parent coaching. These kind of break down into kind of 3 broad categories. The first is synchronous. This is sometimes referred to as live coaching. And this is where the coach is actually providing direct instruction and feedback to a single family via video conferencing, or running a group with multiple families via video conferencing. So with synchronous instruction, all of the instruction and the practice and the feedback is all being conducted live over teleconferencing or video conferencing. We also see asynchronous models, and these models involve either where the parent is watching or completing a tutorial or webinar on their own, so they're doing self-directed learning, or there have been some models where there is some level of self-directed learning, and then the family might then submit a video of a parent-child interaction, which is then reviewed offline by a coach who then provides them with feedback. So by it being asynchronous, it's involving either that self-directed learning component where the parent is completing this separately at a different time from the developer, or they're submitting video offline and getting feedback offline, so there's no direct face-to-face or moment-to-moment contact between the parent and the coach. And then we also see hybrid models where the parents or the family is completing some type of learning activity on their own while also receiving learning support and feedback from a coach. And the research that we've been doing in our lab on Project Impact has been primarily using a hybrid model, but I know that Anna in her practice has been shifting over to more of a synchronous model. But we've also had at moments when we've had to do some asynchronous work as well. So you just keep that in mind when we talk about the different ways we can deliver parent-mediated intervention. So when we look at the evidence base for the use of telehealth, we're actually at a really good point right now because we have a growing evidence base suggesting that telehealth is an effective treatment modality for delivering a wide range of services. And there are a number of different disciplines who have very specific statements in their ethical guidelines around the delivery or the use of telehealth to deliver services. We also see a number of single case and group design studies that have shown that telehealth can be very effective for the treatment of ASD. And I have a reference to a paper here, a systematic review of the use of telemedicine in autism spectrum disorders, but the field is growing very, very rapidly. So there are a number of studies that have come out recently on this approach. And so we actually have quite a bit of literature to draw from when we're thinking about developing our telehealth models for parent coaching. One thing I really want to emphasize is most telehealth programs for parents of children with ASD have involved synchronous coaching and preserve those effective elements. So when we're thinking about how to do this effectively, we want to make sure that we're keeping in those effective components of parent coaching, even if the modality by which we're using them is different. And just so you know, in the materials that we'll send out after the webinar, there is links to a number of online references and studies related to the use of telehealth in autism. So one of the real advantages of using telehealth to provide parent coaching is that it is cost effective for parents and providers. So we don't have to factor in the issues of transportation or hosting or having to have a location that people have to come to. So in many ways, telehealth has the added advantage of increasing access. This is particularly the case in rural areas and underserved areas that may not have as much access to in-person services. Another benefit, depending on whether, and some of this depends a little bit on whether you're using a synchronous or a hybrid model or an asynchronous model, but for asynchronous models and hybrid models, some portions can actually be completed outside the traditional work week. So this again increases access because parents can be doing some of the learning during times when they are not having to be at work. We also see some specific benefits of doing parent coaching over telehealth that we don't have when we're doing it in a clinic, which is because you're actually seeing the family in their home environment, you can develop a better understanding of the family's homes and their home routines. Another benefit is, for those of you who've done parent coaching before, you know there are some families who are somewhat hesitant to get involved and actually work with their child, particularly if the professional is in the room. But when we're doing telehealth coaching, we actually can't get in and model with the child or do direct service delivery with the child. So the parent is really in the position where they really have to be doing the primary intervention provision. And so it can be a really good strategy for encouraging parents to get in and practice if they've been hesitant in the past. Depending on the kind of software you're using, parents can actually take video of routines that happen when you're not there and share it with you, so you can actually get a wider understanding of the child's experiences. It also provides many more opportunities to include other family members. And at this particular time where we have families at home, there are going to be a lot of family members who potentially could play a pretty significant role in intervention with our kids, including siblings, extended family members who may all be in the same home. And then finally, again, some of this depends on the software you're using, but you do have the ability to, if with parent permission, to record and potentially share those sessions with families. So parents who can't actively participate in the online coaching would have the opportunity to look at and gain information later. So I want to just pause really quickly and see, were there any questions that would be things we should be addressing as a group live?
Hi, Brooke. There was a question in the Q&A about families who don't have access to internet and using these practices over the phone. It's come up a couple times. I was wondering if you could address that out loud for the group.
Yeah, so we will talk. Most of what we're going to be really talking about today is to be doing more of that live internet-based coaching, but there are different models. So the asynchronous models can work. There are video-based guides. Most of them do require internet access to get access to the online components of it, but people could have that offline, downloaded and saved on a jump drive that's sent to the family. Parents also could potentially do some consultation over the phone, although it is incredibly helpful to be able to see what the parent is actually doing. So in cases where internet connections aren't great, but and aren't really sufficient to be able to do that face-to-face coaching, there may still be options where parents might be able to upload or share video that comes up slowly that the provider could view offline in more of that asynchronous model, and then do follow-up feedback by phone.
Yeah, and I'll just add, if you have to do it primarily over the phone only, I mean, having the handouts and tips for families of what they're going through in a really structured session, as when we get to the coaching sessions, that you can talk them through, can be more helpful than not doing anything at all. And I know this is one of the challenges that we're working through with some of the school districts in the rural areas in Oregon. When there isn't that internet access, how can we still provide that services in terms of teaching specific strategies? So when we talk about the coaching sessions, thinking about the format of that and how you could structure it over the phone.
One other thing I'll mention, and this is in the resources that we'll be posting later, is that there are a number of low cost and free internet services that are available currently during the COVID pandemic. And a lot of the families that we've worked with actually do have cellular service. And so a lot of what we've done is over cellular. And currently a lot of the major carriers are suspending their overage charges right now for plans. So there may be some additional resources available that families may have access to during this current crisis that they wouldn't normally have access to. So I'm going to talk a little bit now about preparing your practice for telehealth for those of you who have not done this before. The first thing to note is that telehealth guidelines and regulations are dictated both at the sort of ethical guidelines by discipline, but also they're regulated by the state and by and so all of these things typically apply across disciplines and across state regulations. The key things to keep in mind are client confidentiality and protected health information. So we always have to be aware of HIPAA when we're working with clients. But when we're talking about doing telehealth delivery, we have a different type of compliance that we have to keep in mind, which is making sure that the software that we're using to exchange information with families is HIPAA compliant, and that it actually has a business associate agreement worked out with the company that you're working with. Now, I'll mention this again in a moment. Currently, during the pandemic, in the United States, the Department of Health and Human Services has waived this HIPAA requirement. But it is something to keep in mind, particularly if you're going to go forward with continuing to provide telehealth services, is to make sure that the platforms that you're using are HIPAA compliant and using and really thinking about protecting private health information. That also applies to things like electronic data storage and transfer. So in addition to whatever telehealth service system you're using or video chat system you're using, you also want to make sure that things like email exchanges, saving files, records, all are being electronically stored in as safe a way as possible. And that means using things like encrypted passwords, storing information on protected computers and hard drives. Now, this is something we would have in our practice, but as everyone is having to shift to home, it's something in particular that we really need to think about, because oftentimes our home environments are not set up in this same way. So again, although these HIPAA requirements are being waived during the pandemic, it is really important as a practitioner, if you're going to be doing telehealth coaching out of your own home, to really think through, how am I going to be able to store information privately for my clients? We also need to have informed consent. So providers need to make sure when you're shifting to a telehealth model that parents are aware of the differences between telehealth and traditional in-person services. And you would do this for any type of service you provide, but we really want to outline ways in which things might be different in terms of health, protected health information and exchange. Also, a lot of these telehealth-based video conferencing services do provide the opportunity to do video and audio recording, which can be a really nice thing, but we need to be very careful that we're letting parents know, if we are going forward, that that's what we're doing and that we obtain consent as needed. We also want to mention that there are going to be some increased privacy risks with telehealth that we don't have with traditional in-person services. So we want to make sure we're outlining what those privacy risks are for families, as well as what the cost will be and whether insurance coverage will occur. Some disciplines and some states actually cover telehealth. Almost all places cover telehealth and insurance, but it varies. And so you really do need to be aware of insurance coverage and how that might affect the family's payment. And then the last thing is, again, coming back to this idea of reimbursement. The ways in which telehealth is reimbursed are actually dictated by the state and individual insurance companies. And it will depend a little bit on the modality that you use, whether you're doing that more synchronous or asynchronous or hybrid approach, as well as the specific software that you use. So it's really important to make sure that you know what you need to be able to get reimbursed. And again, there are resources that we're providing online to help with that, at least for the US. Now, thinking about what are the technology and space requirements that you're going to need and that the family is going to need to be able to participate in telehealth-based parent coaching. Both of you are going to need either high-speed internet or cellular service. You're going to both need access to a computer and webcam, or a smartphone or a tablet. But there's a lot of variation. A lot of these platforms, you can like one person can have a computer, the other person can have a tablet. So there's a lot of variability in the types of devices that can be used. You're also going to need to use some type of video conferencing software, which I'll talk about more in a moment. You're likely going to need some way of communicating with the parents offline, typically via email or text, in order to send them the link if you're using video conferencing software, and to exchange documents like informed consent, etc. The coach is going to need a private space to be able to do coaching. So you want to be thinking about, again, protecting your client's privacy as much as possible. So if you're in the home, thinking about, is there a place that you can do the coaching where you'll be uninterrupted, that the parent can maintain privacy, and that it's not as distracting to the parent. And then finally, if you're the coach, a headset is very helpful. Again, this helps with privacy, and it helps keep what's happening with the parent kind of limited to your interactions as opposed to being broadcast throughout your home. So just a note on video conferencing and video chat applications that are used for conducting parent coaching. So there are a number that are out there right now that are HIPAA compliant. So I have up here all those that are HIPAA compliant. Anna and I both use Zoom. It's actually a really great platform. It's got a lot of really nice features. So we'll be talking a little bit about how Zoom, some of the features of Zoom can be used well to do parent coaching, but there are other options too, Skype for Business, Google G Suite Hangouts. There are a variety of different HIPAA compliant programs, as well as some that are specific for doing a fully remote intervention practice. Now, currently, the Department of Health and Human Services have waived the requirement for HIPAA compliant software. So they have indicated that there are a number of things you can use that are not HIPAA compliant, but that can serve families during this time, including Zoom and Skype without the business associate agreement, Apple FaceTime, Google Hangouts. But they are very explicit that things that are public-facing apps, such as Facebook Live or Twitch or TikTok, may not be used. So you actually probably have a lot of options at this moment, but you also need to think down the line how you're going to be doing this as to be in line with HIPAA compliance as much as possible. So I'm going to shift and talk now a little bit about how do we set families up for success with telehealth coaching. First, I want to acknowledge that when we do telehealth coaching in our research, families are coming in knowing that that is what they're going to get. Whereas many of you are in the position where you're having to shift right in the middle of an intervention program to online coaching from in-person coaching. And some of you are actually probably shifting from in-person direct service delivery to now doing parent coaching over the internet. So I just want to mention that it might take a little while to get our families successful with this approach. And I just want to make sure that everybody realizes that it can take a little while, and that's okay. So the first thing you want to do when you're introducing telehealth with the family is you want to make sure you're going to be discussing the relevant information for telehealth. And we typically do this by phone. During this time, we want to highlight the specific service delivery model we're going to be using. Are we going to be doing that synchronous model? Are we going to be doing a hybrid model? If we're providing the families with self-directed resources, are we going to be doing an asynchronous model? And you want to make sure in that initial contact, you're really talking through with parents the structures of what would be expected in the sessions, the equipment that they might need, and how to set up their home. You also want to make sure you're discussing the privacy risks, how information will be shared back and forth, and again, trying to limit protected health information as much as possible. Consent for audio and video recording if it's going to be needed, and then a discussion on the cost or reimbursement for this type of service. Then you're going to spend some time really helping the parents identify barriers to participation and really helping them problem solve. And I always start with acknowledging that it may actually take a few sessions for this to start feeling comfortable. And given that we're in the middle of a major disruption in almost all families' current home routines, really the first few sessions are going to be spent planning for the current situation rather than focusing specifically on just picking up where you left off on your in-person session. So you really need to think about really helping the parents be able to participate as much as they can, and there will be a lot of problem solving involved in this. And then I always recommend following up with written information so parents have access to that offline. Now Zoom, as I mentioned, Anna and I have both been using Zoom to do coaching, and Zoom actually has a number of very nice features that actually lend themselves very well to doing telehealth coaching. And when Anna talks about how to do the telehealth coaching, she'll kind of refer back to these different functions as to sort of how they would work well for that particular component of parent coaching. So there's the video chat option. This allows the two-way back and forth face-to-face, which is really nice, particularly great for the active coaching. There's also a screen sharing option, which is what I'm using right now, which is really nice because it allows you to share information directly with parents so you guys can be looking at documents or pictures or graphics at the same time. There's also a chat function, so parents can send questions back and forth with you. There's a screen recording option. Again, this is really nice. It's really important if you're being clinically supervised to be able to do this, but it's also really nice to be able to record the screen and share that information back with the parent. And we actually see telehealth being used for groups as well. And there is a breakout room function in Zoom, which allows people to get into smaller groups and have face-to-face discussions separate from the larger group, as well as a whiteboard function. So both of these actually lend themselves very nicely to being able to do telehealth-based groups. Oh. So one thing I just want to mention briefly in thinking about technology that families are going to need. Again, we mentioned they need to have either a laptop or a phone or a tablet. Thinking about that technology, laptops work very well, or this could also be a desktop with a webcam. But laptops tend to work really nicely, and we use them a lot in our telehealth research because they're pretty easy to prop open and you don't need to stand, and they work really well for screen shares. So if you're really trying to show the parent a specific plan that you're working through together, or text or a manual, they can see it much better on something the size of a laptop than on a phone. Also, we do a lot of filling out forms and planning the parents between session practice together, and it works really nicely in that screen share function to be able to fill that out live on a laptop or having the parent do it themselves. The nice thing about smartphones or tablets is more families are likely to have access to this. And again, these don't require internet service beyond cellular. So when we look across the country about in the US, what access we have, families are more likely to have access to cellular service on a smartphone than they are to home-based internet services. So it is an option for families that are harder to reach. It's also more mobile, so parents can take it room to room with them easily. They can even take it outside. And as I mentioned, you can use cellular when internet speed is not present or is problematic. So a key piece to doing this successfully is to really helping the parents problem solve how they're going to set up their room. And if you're doing in-home coaching and you're switching over to telehealth, a lot of this might have already been done. But one of the differences when you're doing in-home coaching, you're not available to kind of jump in and help the parent or follow the parent and the child if they switch rooms. So one really key thing that's helpful is to have the parent identify the space that they're going to coach in and really recommend that they're in a small space that where a door or some other barrier can be set up to keep the child in one place during that active coaching process. We recommend placing the camera across the room so that you have the widest angle so you can see as much of the interaction as possible. When we're working with families who have smartphones, oftentimes they'll try to put them really close to them, and it's really hard to get a good view on what's actually happening. So we spend a good 15 minutes sometimes having the parent move the camera around the room to try to figure out what's the best angle. If they are using a smartphone, we recommend having the parent purchase a very cheap stand so that they can actually have it sit standing up. Again, I think it's hard if parents are trying to prop up their smartphone on furniture, it falls over. So these stands are about $5. You can get them on Amazon and they can be really helpful. Even with that, we sometimes have kids that are really mobile and it's really difficult for the parent to stay with the child. And so we actually have seen people successfully coach by putting their smartphone either in a shirt pocket, so it's facing out and filming the child, or in a case that can be worn around the neck. They're clear plastic cases that kind of keep cell phones waterproof, and the parent can wear it around their neck and follow the child, and then you can be moving with the parent. And then we do not require this, and in fact, when we do this, our families typically don't have wireless headphones, but they can be very helpful if the parents have access to them, particularly for children that have more language. It's much less disruptive because the child isn't then hearing what you're saying. What you're saying, only the parent can hear. So I'm going to take a pause here and see if any questions have come up related to the technology components.
Brooke, we have been getting several questions in the Q&A actually about the consent process for working with families over telehealth and both the logistics of that consent process and a little bit more about kind of how you go through it given the additional risks of telehealth.
Well, that's a really good question. I mean, I could probably let Anna respond to that because she's been doing this right now.
Right, so for the consent for telehealth, and I'll talk about it in the documentation, you have to document that the parents agreed to telehealth services. And that can either be done verbally, and you can write it in the child's chart, or it can be done via email if you have the secure email, or it can be done, like I said, over the phone or in writing. And so I have a consent form that we just send out that they're agreeing to telehealth. For mine, it said whether or not, I wasn't sure whether or not insurance would cover it until we spoke with them, but do document somewhere in the chart that the parent has consented to telehealth with that aspect. And that and discuss some of the constraints that there might be to privacy when you're providing services over the internet as well.
Another question is related to privacy in the home, either if the family you're delivering services to has a very small home with limited privacy, or if you as the provider have a small home with limited privacy.
So I think in these times, you just do the best that you can. I think that that's what you want to keep involved in that discussion with the parents of what the increased risks to privacy are, that they might be both in the family's home, as well as also there is the possibility that other individuals in your home may be exposed. You'll try to keep it as much as limited as much as possible. One thing we can do is try to avoid using the family's full name on anything. There may be situations where, depending on the severity of the behavior, that it might be counterindicated to do telehealth, particularly if there's concern about certain things being caught on a video camera in the home. So I think all of those things are things that just need to be discussed with the family as well as the agency, and just having that awareness be there, so that parents know what they're agreeing to do.
Okay, well now I'm going to move on to talking about the coaching sessions themselves. Let me just pull this up. And can everyone see the screen? Brooke, can you see it now?
It's a little bit, I think in 1 second, it isn't fully out. It's got a little bit of lines in it.
Anna, people are having a lot of difficulty hearing you. Is there a way you can adjust the microphone or speak a little louder?
Yeah, is this any better?
That's a lot better, but if folks could chat, if that works for them, I can let you know.
Okay, thank you. And hopefully the screen is a little bit better now.
Yeah, try going forward. Right now it looks like it's in the middle of a share.
Okay.
But your volume is great, but the screen share is still not working correctly.
Okay, let me stop the share and let me try to do it again. On my end, it looks like it's working.
While she's doing that, the other thing I would mention is, as you have this consent discussion with families, mention that technology is wonky and that it's quite possible that they might get disconnected. You might drop out, you might not be able to see certain things, and it's perfectly okay that they can always call back, you can call them back, and I think that really normalizes things.
Yeah, let me.
And Anna, when you do, I think this will become relevant as you start your section. Could you talk a little bit about mandated reporting?
You mean to like Child Protective Services or mandated data collection?
Child Protective Services related. So how mandated reporting and how it might be complicated by doing telehealth in families' homes.
Right. I mean, so I would say the same rules would apply that that I am a mandated reporter. So if I have any concerns about the child's safety or anything to bring up, I always err on the side of caution and reporting that and calling Child Protective Services and letting them know what you're seeing, hearing, or worried about for the child. That's what we're mandated by law to do to protect children with that.
Yeah. So I think you would just also make sure that, and this should be in any consent process, but that you're mentioning that you are a mandated reporter, and if there's anything that you view that raises concern, that you do need to report. So just parents are aware of that.
Yeah.
Yeah, and Anna, you might try to move in a little closer to the microphone.
Okay.
There we go.
So I am I am pretty close. I don't know what's happening. Can you hear me better now?
Yes.
Okay. And can you see the screen?
Yes.
Okay, so I am going to go through the conducting coaching sessions, and we will talk a little bit about the sequence of the session that you follow is going to be similar in terms of planning for the sessions, preparing the families for the session. I think it's really important that you have a clear outline of what they are going to expect. I know many of my families had anxiety about moving to telehealth. We were in all in-person sessions. What is that going to look like, particularly for children who have significant impairments and difficulty engaging. So I think the more you can prepare and plan, the more successful your sessions will be. And then talking about the cycle of the sessions and how you will rotate through them. So the first thing that's important when you're planning is you want to engage and empower the parents. So we really are looking at a collaborative relationship, and parents are more likely to participate and become a member of the team, which we need when they're engaged in the process, and they're empowered in the decisions, both the goals that you're going to address and some of the problem solving. So as you're working with parents, you want to make sure that you're working very collaboratively and that you're responsive to the parents' needs. And I think that's something I'll talk about when you set the first sessions and you're looking at goals. Right now, there are many disruptions in all of our lives, and we're having to learn how to restructure that. So being responsive to some of those needs that may come up, particularly given this current situation. It's also, as Brooke discussed earlier, it's shared expertise. The parent is the expert of the child. The parent is the expert in knowing what's working in their home, how their home is structured, and we can help them problem solve and provide strategies to address those goals. So it's really a collaborative relationship between you and the family. And then you always want to use a strengths-based approach. So really focusing on this is going to empower parents and make them more engaged. What's working well? What are the strategies that they have that are working well? What skills can we build on with the child? And we'll talk about that a little bit when you are doing the coaching model to really build that collaborative relationship. That's going to be really important to success, because for telehealth, in this model and with children with ASD in particular, you really need to have that collaborative model. The parent's going to be doing the coaching. So getting that engagement and buy-in early on is important. And there are programs out there, we talk about it in Project Impact, that talk about building these relationships. And then you, of course, want to gather information for the parents on both the child's family and the child's needs. So you are looking at what are the immediate needs that the families might have given the current crisis and situation? What are the child's needs when you're going through? And these may be slightly different than what you were doing in your one-on-one sessions. It may have shifted some with that aspect. And so I want to refer, you're going to have resources that will be emailed to you and will also be up that, and Affirm has some free checklists that you can go through really when you're thinking about planning and implementing the parent coaching sessions. And so it's free, and I recommend you look at that, and it can kind of provide an outline for that. But the first thing too that you're going to be doing is identifying the child's strengths and areas of need. And you want to revisit this with the parent. What do they see that's going well? What are some areas that they might need help with? I mean, essentially, like what can you help with that might have the greatest positive impact on the family's ability to complete their daily activities that they need to now? For me as a speech pathologist, their communication and engagement areas as well. And so once you've gathered the information, it's important to set goals collaboratively with the family. So you want to use the data that you collected when you gathered information to set the goals. And when we just did this with a family with whom I'm working, and it had been a clinician of mine, was working with them one-on-one, not doing parent training, but you can be reviewing some of the information that you had on your treatment plan for them as you're going through, and ask for parent input. Maybe the goals have changed. Maybe there's something more critical to work on at that point. And so we had one of our sessions reviewing the goals and asking the parents what would be important to them and looking at some of that structure with them. And then you want to collaboratively set goals that are meaningful to the parent. So the parent, in order for them to be working towards the goal, it has to be something that's meaningful to them and is going to have a significant impact on improving their family functioning and the child's ability to communicate with them. So you can show the goals and then ask the parent for input. If you're starting a new family when you're doing this, you might be reviewing old assessments and then checking in with the parents on what they feel like the accuracy is and which aspects they might want to develop goals for. And you want to start small. So I think this is important. As we're starting the parent coaching, we want the families to feel successful. If we're starting with a huge goal and we don't break it down, it might be harder to see that incremental progress. So you really want to start small with the family and help them. Your role is to help take their goal and break it down to something that's small and measurable so they can see the progress that they're making with their child. Whoops, I don't know what just happened there. So I'm having all sorts of technological issues now, and I know when I was talking to someone somewhere else, screens freeze and more people are getting on the internet, I know, and using Zoom and different things than ever because it's how we're all working. So sorry about that. And I just explained to families that that just happens. So you want to start small so the parent will be successful, but then you also want to make sure you're providing resources for goals that are outside your scope of practice. So who else can you refer to? And I know this is a challenge, like thinking of some of the children that I work with, families are trying to seek out counselors or other areas of work, and then they're hesitant about jumping on with telehealth, which is how we're supplying services. So really helping the families also try to have those resources. So you're going to collaboratively first decide what are the goals, what is going to be the most important place for you to start, as that's going to drive your intervention. And then you also want to do something to help identify the routines of the home and the daily activities. One, because this will be a place then you can work with the family to discuss how you'll embed those teaching strategies that you're going to be teaching them into those already ongoing routines. And it can also help you identify any of those routines and activities that might be particularly challenging, and that might guide as a place that you need to start for the intervention as well. So once you have the goals, that's going to be the starting point, and this may take a couple sessions, but it's really important that it's clear that the family knows what they're working towards, that they have buy-in, and that they're motivated to work towards those goals. So it's important to take that time as you're going through. Once you have the goals, then you want to select an appropriate evidence-based practice. So you're going to select the practice that you're using. We're, of course, talking about children with ASD. That's our area of expertise and what we know. But knowing other occupational therapists that I might work with if they're working on motor skills, you're going to choose whatever program it is that's going to address the goals that you have for your child that you're working with. And when you go through this, you can select manualized parent coaching programs. And these are really helpful because it's going to structure what you should do each session, the teaching strategy. It will help you be more effective in using that evidence-based practice. And there's some that are available. We have ours, Project Impact, which is teaching social communication. And that's an NDBI that works towards engagement and communication skills. And there's some like we have up there for parent training for disruptive behaviors. So if you can find an appropriate manualized program, and there's a whole list of them in the resources that you'll receive, and you might have some for your discipline, that's a great way to start, and then the parent would have the written materials as well. However, you might have some goals that there isn't a manualized program for, and so we can refer you to Affirm if you're not familiar with it. They actually, this is also in the resource list, have a lot of great resources. That toolkit for what to do with COVID-19 I've been sharing with families, but they also have individual strategies that can address specific behaviors, brushing teeth, helping with picture schedules that you might also pull from to guide in your coaching sessions to teach families as well. And then as Brooke discussed earlier, there are also some self-directed online programs. There is the Help is in Your Hands, the ESDM, which I believe it's free that parents can go through. And then there's the Autism Navigator as well, which has some fee-based parent programs that they can go through. So if they have access to the internet or via phone, you might refer them to some of these online programs, and maybe you could coach between them. But regardless of which program you choose. Once you have the goals, those should drive the program that you're selecting. So that's kind of the second step. And then the third step is to prepare for the sessions. And as I said, I know a lot of our families had anxiety about shifting to telehealth and not knowing what to expect. So you really want to take the time to clearly define and describe what the sessions will look like. So you'll develop an implementation plan with the family. And so again, this would just be beginning with you're reviewing the goals. Okay, we have, we're working towards Johnny requesting or engaging or staying with us at mealtime, and then describe the program that you've selected. I found it helpful if you can have any of the written information to share too, so they can read about it as you're describing it. But you're going to let them know the program you selected and why. Again, I always think it's important to know for the parents to understand why they're doing it. And then you want to go over the format of the sessions with the family. So what their role is going to be, and I'll talk about this when I go through the cycle of the sessions, but when the child's present and when they're not, and what the sessions are going to look like, because that can also increase the engagement and decrease some of the anxiety of the unknown. And then reviewing the materials and the space needed. And this is really important to prep them for too, to set up the child for success. If we think about in our clinics, we're always having, if you work in a clinic, your space set up and the materials available before the session, and it sets you up for success. And similarly, we want to do what we can to set the families up for success. So we're going to revisit that and discuss what that might look like. And all of this time spent in the beginning is really going to then set up your telehealth sessions for more success. So it's important. You also want to make sure that you have all of your materials prepped that you need. So like I said, ideally, if there's a parent manual that goes along with it that they can read about it, or any handouts or tip sheets that you have, that's really helpful to have that available before your sessions and things to share with them. Video examples, as I'll talk about when we get to the demonstration piece. You can't obviously work with the child because you're over telehealth or you're on the phone or connecting how you are. So how can we have them see what the strategy looks like? Because I think that's valuable. And then thinking about what's your data collection going to look like and maybe practice plans. So again, we have written practice plans that we fill out. I'll talk about with the families, but what is that going to look like? And sharing all of that information with the family before the first session so they can ask any questions, they know what to expect, and it gives all of you the clear program to go through. And then I always like to follow up via email so that you can share okay, here's the meeting link if you're doing it via telehealth, and the information that they might need, the time of the meeting, and a little summary, a written summary to let them know what we had discussed. So I don't know if there's any questions here before I get into the cycle of the sessions.
Anna, we have some folks asking about how this looks in groups. So if you're not working individually with families, what are some of the adjustments for groups? Will we be talking about that later, or could you speak more to that?
So we're not, today we did a little bit on groups in our last week session, but today we weren't talking about it. If I was going to be working in a group, I would probably still do the individual goal planning with the parent one-on-one, if at all possible. If not, I might do something through Zoom. Does have the group breakout where you can present the information in a group model. You could talk to the parents and ask questions and then have them send you specific information about the child, or take time to share this about goals in the group format. When we do our group, we talk about the different areas of development to parents in a group session, but we work with the parents to build that engagement individually for the goals. And then when we move to the cycle of sessions, I can talk about how that would be done in group. And Brooke, I don't know.
Yeah. There have been a couple group-based models that have been delivered successfully over telehealth, and it looks a lot like a webinar where there's some sharing of information, usually a slideshow with video examples, and it's kind of a didactic experience, but it really helps to also, as Anna mentioned, pause and do either breakout sessions if you have a large group, or smaller discussions to really help make sure parents are understanding what they're learning.
Okay, so once you have the goals and you have the program that you're going to use and the parent knows what to expect, you're going to run through sort of the same cycle for each session when you're teaching it. And the first thing to do is prior to each session, you want to send the parent the session goals and the agenda. So this lets them know. And so if you were doing it in a group, you might send it to the whole group. And let them know exactly what you'll be targeting during that session and the structure of the session. This helps save time. One, it decreases anxiety, I think, of the parents or any of us if we know what to expect. And two, it helps save time because you have that portion structured for them. You also want to talk about the materials and the space needed. So this is important. We're wanting to set the parents up for successful interactions during these coaching sessions that we're doing via telehealth. And we know that it's very important if you think about how you can eliminate distractors in the room, the environment, as well as maybe having motivating materials. For some of my kiddos who really like food, I might start coaching around snacks. You're setting up that plan for the parent. That will save time during your session because you'll have that available. I also like to talk to them about when the child needs to be present and when they don't need to be present. So for those of you, and it seems like a number of you already do parent coaching sessions, when I'm doing them in person, the child's there with us all the time. We're in the home and going back and forth. Well, here, the child might not need to be in that area, and you'll talk about helping them transition when the time comes. I also like to ask for input. So this lets me know, particularly at this time, there's different crises that might come up with the schedules, with the routine, or trying to plan with the family. So is there anything else that they want to address that I haven't covered in the goals and agenda? Because that will let me know how I can restructure and have any information available that I might need for my session to make it run a little bit smoother. So for example, some children may have had an increase in some challenging behaviors. Their routine is completely disrupted. They don't have people coming into the home to help as much. So maybe we, when I'm using Project Impact, go to the managing challenging behavior routine, even though I hadn't needed to use it before. So asking for input will, one, let the parent know that their concerns are being heard, and two, let me prep so I can save time during the session. And then, of course, setting the meeting information, the link, the time. And so even if you were doing this via phone, which I guess you couldn't email them if they didn't have internet access, but you might be calling or trying to follow up with them. And then the next thing that you want to do is begin the session. And I like to begin each session with a check-in with the parents. And so this just lets the parents know, and I try to keep this more specific, sometimes even during when we're in person. How was your week? You can get a lot of information that might not necessarily pertain to your session. And because we have a limited time, trying to stay on track, but how did it work when you practiced prompting to get him to request? And we reviewing the between session practice. So ideally you have something that's been written down for them so that they knew what to practice, they had any tips about it, and then you're just going to pull this up. As Brooke said, we both use Zoom, so you can share the screen and pull this up and show them what you were working about as you talk through it. And you help the parent problem solve any challenges that they may have had, and using open-ended questions, really having them be a part of it that can improve practice the next time, or that you can practice during this coaching session too, can help with that. And then the next thing you do is you introduce the technique. And when you're describing the technique, this is where it really helps to be using a specific strategy that's clearly defined. Having a manual, you want to tell the parents why, what's the rationale, why should they be using this technique, and how is it going to help towards the goals? And then what are the specific key elements that they should be using? So, do they need to be face-to-face? Are they holding something inside and out of reach? What prompt are they using? So that it's really clear that you have a shared definition, and this will help with coaching and with the understanding of it. And as I said, I mean, parents can learn through different modalities, having the written supports that they read about before or things to follow up, as well as the verbal description is great to help them. So if there's a parent manual or a tip sheet or a checklist that you can show and you can split the screen to with that. And think about, sometimes I know when I'm working with people and they shift from the one-to-one individual model to coaching model, there's many things that you just naturally do and aren't thinking about. So if I'm thinking about an NDVI, I'm gonna, focus on the child, then maybe create an opportunity, and then prompt. You want to think about the steps that you're explaining to the parent and think about just teaching one step at a time. You'll be more successful. It's really hard. We all went to school for a long time to learn these strategies, and then they might start come naturally. You've been doing them for a long time, but really breaking it down into those little elements so that you can be successful in coaching and teaching with the parents. And so just to say and highlight, parents need to know, we all need to know what to do before we're getting in there and doing it. And that can decrease some of the anxiety about having to practice if it's clear what it looks like. The next thing is demonstrating the technique, which when I did live sessions, I could demonstrate with the child, which clearly is not possible, again, via telehealth. But we want to be able to show the parent what it looks like. So you can use video. Now, there are videos, I would say, like, for example, again, with our program, when the parent buys the manual, they have access to videos that they can watch for each technique. If you had an internet connection that was kind of spotty, so they could watch them before, but if they don't have access to the internet, the demonstration, which I think is important, is difficult, and have to talk them through it and do some role play. Talking them through role play, but you wouldn't be able to see them. But when you can do the live interactive sessions and you can show the videos together and talk about it, or I set up and have the families role play too. So I might say, okay, now we're gonna get face to face, and remember, show me, how are you gonna hold up in the snack inside and out of reach? Now when he reaches towards it, what will you do? So you're talking them through and showing them what it might look like, and that's where the back and forth video can help. And you want the parents to be thinking about the specific strategy. This is why you can't have them thinking about more than one thing at a time. But you want them to be thinking about the specific strategy and the child's response to that. And then you always want to check in for understanding. And often, as those of you who have been to our workshops, we say, not do you understand, because all of us will say yes, but more, how do you think that you could create an opportunity with Johnny during snack? Or what do you think Johnny will do when you hold it back? To have them thinking about their child in this situation to see if it's been clearly explained with that. And then the meat of the session is going to be that parent practice and feedback. Because if, and this is the difficult part if you didn't have the internet connection, where you would have to be talking them through on the phone, and ideally they would at least be able to share a video with you that you could watch, but the coaching can really enhance their use of these strategies. So what you want to do is cue the parent. So up until now, the child hasn't necessarily had to be part of it. You're talking the parent through it, which can be an advantage if they have the child interacting in another space. I know for me, many times all the siblings are home now as well, so they might be interacting, and popping in or entertaining the children. But then you make a clear transition statement and say, okay, now we're going to bring Johnny to the table to work on snack. And so you've made sure that all the materials are available and the space is set up. And this is really important. You want the parent to feel successful in the beginning, and we know the environment can have a large impact on that and having the materials available. So you give them the transition statement and have them come, and then you encourage them to practice. You've said, okay, now remember, we're going to, practice controlling access to the item and using a question or a prompt, whatever you might be using to help them request. And while they're practicing, and I'll talk a little bit about feedback, it sounds like a lot of you have done parent coaching, so you'd be shifting into some of those same feedback rules that you use in a live model, where you're providing positive and corrective feedback, more or less directive, and you can do it live or via video. And then we'll watch a very short clip of online session. So when you're giving feedback, you want to provide frequent feedback. And I notice this is something parents, if they know you're watching them and you're supposed to be saying something and you don't say anything, it can make them feel uncomfortable. So you want to be saying something, you know, every minute to 30 seconds. And you want to give feedback on only a limited number of techniques. So I think about it, if I was given direction on a new sport or activity and I'm told, okay, you know, hold the club like this, shift it this way, and you're given too many pointers, it's going to be difficult to track. So that's where you want to give the feedback only on the strategies that you've just clearly defined to them over the phone. And you want to keep your comments pretty short and succinct to what they are. You can wait for a natural pause. For some families, so when you're doing telehealth, screens can be distracting. You know, often when we talk about setting up the environment, we're like, cover up all the screens, right? Well, you can't do that. There is on Zoom a feature where you can hide, so the parent, you can still see their video coming in, but it hides the image on their side. It looks like the screen is blank to them, so the child can't have that on, but it can be distracting. Or for some children, it might be distracting when you're giving feedback, so maybe the parent wears headphones, or maybe you wait for a natural pause so you don't interrupt the interaction. You can also record the interaction, and Zoom again has a nice feature where you can, in the chat, which you guys are all using, I think, section, you can type up your comments and then go back and review the video with the parent. So you want to think about what you can do to avoid disrupting the interaction. You can turn on and off your camera. I actually did that, and that effectively gained the child's attention, so the parent could then get access to the item to control access to it. But you're going to have to think about some of those parameters too when you're working, so you're not disrupting the interaction, but yet still able to provide feedback. And you want to watch for the parent's response to your feedback. So you're really going to start more with positive feedback, as I said, and see how the parent's responding. Do they respond better when you're giving it in the moment? Is it better delayed? And I ask them. Say, everybody learns differently. What works best for you? And that can guide how you're structuring your feedback as well. And then, as I said, you focus more on positive than corrective feedback. So when you're giving positive feedback, just to go through some of these slides, you acknowledge the parent's efforts. Parents I've worked with are always working really hard. You're working really hard to follow Carlos's lead. Or point out what the parent did correctly. That was great how you got Jimmy's attention before asking him what he wanted. And then you can point out how the child responds to what the parent's doing. So sometimes, particularly with those children who are pre-intentional or building their communication skills, it can be difficult to see what they're doing. So you want to point out some of those behaviors too. Lucy's so engaged with you when you imitate what she's doing. Or explaining why a child is responding in a certain way. Peter is making great eye contact when you hold the toy in your line of sight with them. You always want to start with positive feedback. There's some families you might find that you coach only through positive feedback. And then I have some families that are like, okay, well, tell me what I should do next. So that's where you're going to be really watching the parent and having that collaborative relationship to see what works best for them. You can also talk about corrective feedback. So that's a little bit more directive. Maybe you model the language for the parent to imitate. So in one of my last sessions, I was wanting the mom to say, my turn, and she was doing great, taking a turn in the object. And so I just said, you know, over the telehealth, my turn, so that then she could imitate me and it could help the child. Or you can suggest a strategy for the next opportunity. So next time Scott reaches for the ball, wait a few seconds before you ask him what he wants. And I like to start with positive, like, great, getting in his line of sight. Now let's hold up the item, you know, a little bit further and see what he does to get it or control access. And then you can remind the parent of the technique too. Remember, let's use one word to describe, or two words to describe what Brian's doing. And then you can tell the parent exactly what to do. Hold the ball up, or like in one of my sessions, I was like, we might have to stand up so they can't grab it from you. So we're not reinforcing that aspect, but giving them that information on what to do. And then as you move along, you start to give less directive feedback so that you can help the parent begin to independently problem solve. And they're making these observations. So just giving them an inferential comment. I notice Carson uses more words when you use shorter sentences. So they're starting to think about this and give themselves feedback, pointing out how the child responds to them. Mark seems to look at you when you use animation. Asking a question to help the parent problem solve when you're going, how do you think you could get Olivia to initiate with you or encourage Olivia to look at you with that? And as I said, as you go along, you want the parent to start giving themselves more of the feedback. So you're going to use less directive feedback. And I know that is a very short thing on giving feedback. There's some programs that you can that go through some of the coaching. We talk about that a little bit in ours. But I want to be able to show you a short clip. And then I should say we're working to get to all of the questions. There's 16 or 1700 people here, so I apologize if we don't. You'll have our information at the end. And then last, you want to reflect and plan for practice. So we're asking the parents, you know, have them reflect. How did that feel? Do you have any questions? What do you think worked well? Going through some of those questions. Providing any tips for practice, and I like to do this in a written format. So we have the written practice plans, and we're going through the sequence of what they can do when they're practicing. And then I always follow up with an email and send any documents that I have to them, since it's not in person, giving them the practice plan, maybe any tips to remember, scheduling information. And I guess if you were doing this over the phone and mailing, you would have to mail that information to them. And then prior to the next session, I send a plan, and your follow-up plan kind of drives your email for the next session that goes over the same format that we discussed. You're pretty much just checking in, reviewing, introducing a technique, showing it, practicing, and reflecting on that. So it does get easier once you've gone through the model. So I thought we'll take a quick minute and just watch a short clip of what an online telehealth coaching session looks like. And hopefully that I won't have technical difficulties now. Can you guys see that?
Mm-hmm. Yeah.
Yeah. No, but now that she's talking so much more, she's using
You can see the coach
so
down
more.
there.
It's like we kind of get used to her talking almost, you know?
Exactly.
Which is awesome. That's great.
She's saying like numbers, the word numbers. Oh, I know. She said hat on and put a hat on. And then she said hat. And then she walked over to a rocking horse and she put it on the rocking horse and said hat on the rocking horse.
That's a great play and language.
Yeah, she's been pointing a lot too.
I'm telling you, she's just really starting to.
Yeah.
Kimmy, that was so good that you waited until she gave you the word instead of suggesting her kind of speak free.
Yeah, she just said it like 4 times. More bubble, more bubble, more. 1, yes, 1. Okay. 1. That's good. 1. More bubbles. More good. More.
That was a point and a bubble.
I don't want bubble.
That is awesome. With a point, and she looked right at you.
So there you could see that the coaching session looked similar, I'm sure, to those of you who are running through the coaching sessions, in an in-person format. You could see the clinician down in the screen, providing the positive feedback to the parent, and the parents interacting and getting that engagement with them. And that's where I find I really do like it when you can use the interactive and live video for feedback, because you can help facilitate change in that moment. I think the family I'm working with, and they, as Brooke said, the advantage, they've gotten back in there and they're really helping their child communicate. This child's using an augmentative communication system, but communicate during snack we started with to get them more successful in setting up the coaching through there. So that is a quick rundown. Like I said, Affirm has some, and our program, it goes through the coaching sessions, but the cycle of sessions, and you'll have access to these slides and some of the resources when you're thinking about shifting to the telehealth sessions. So briefly, I think there were some questions about this. In the beginning, you of course do still have to document. You want to obtain authorization from the family and document it in the child's record. So you can write it in the record. It can be written from the parents. I personally, just to save time too, came up with a contract that outlined like some of the privacy things, what telehealth is, that parents have, the right to continue or discontinue what you might have in there, that they've agreed to it. You also do want to document that the child is suitable for this modality. And so that again can just be written in the client form. And I will say we had, as we shifted over, a number of clients initially hesitant to switch, like how in the world, difficult enough to get them to engage, are we going to use this? And we have had all of our clients come back on board, and they are finding it to be effective. And all of them have reported, gosh, I'm surprised at how effective it is and how much progress the child is making. In some cases, people are all home and have the time to work with the child. You, of course, also want to track the child's behavior, looking at what's the progress towards the goal, as we always would. Do we need to shift the technique? I like to always track the activities too. What was successful? How can we help plan and prepare for the next session? This is going to guide that message you're going to send at the beginning. The child's behavior. Is there anything we need to address there? What worked well? Any questions the parents might have? And then, of course, you're using the parent coaching model. So the parent's use of strategies and any notes for the next session. Is there something I should have taught that I need to remember to highlight that went well, or strategy for next time? And you keep that in your notes. Now, I will say when I initially set this up, it took me a lot of time to create the forms and email and talk to the parents about the structure and shifting over. But once you get the format done and you're taking notes with the parents on the review session and sending them to it after, it's usually like 5 minutes before and 5 minutes after, because you build that into some of your sessions as well. But it does take time to set up in the beginning.
Anna, sorry to interrupt. Your screen isn't showing full screen. It's showing your presenter view.
Oh, it is. Okay, let me switch that. Oh, why isn't this? Okay, thank you. Okay, is that showing now?
Nope.
Now we can see your face.
Now you can see me. Okay. See, well, now I'm just showing you all firsthand the technical difficulties you might have. And now it's not showing me.
We see it now. Oh, wait, no, we don't.
Okay, let's see. Now do you see it?
Yep.
Okay. So in terms of the take-home message from all of this information that we've given you in an hour and a half, the main thing is it's really preparing for the family for success. So you want to make sure that you take that time at the forefront to discuss how can you deliver the intervention. Are you going to have to structure it over the phone? Can you do it live and interactive? Does it have to be? Are you doing an online training? What technology needs do the families have? And addressing any of those barriers to participation. Everybody's home. Maybe they have a small house. I know we had to discuss all the kids are home now. And when I work with families who might have somebody who works in the hospital or medical profession, sometimes they aren't coming home now. So, really setting up, taking that time to prepare the families for success is the critical first step. And then you want to create a partnership and develop goals collaboratively. So you've decided together what it is that you are going to work on with the child. you're responsive to the parents' needs, and you're really structuring on what's going to be most effective and important for the child in terms of goal outcomes and functioning within the family at this point. Then you do want to use the systematic instruction. So I encourage you to look through the resources of manualized programs, or maybe you have some you use already that are really geared towards targeting those clearly defined goals that you had. They have clearly defined goals for the program and the strategies that you're using, as that will help the family. And then last, it's really important too for the parent practice and feedback, that you give them time to practice and that you're following up with those sessions. So we have just a couple minutes left. And as I said, sorry if we can't get to all your questions, but was there a question that came up?
Anna, I was going to jump in. I saw a number of questions about length of sessions and number of sessions and frequency, and how might that look different from in-person?
Okay, so in terms of the length of sessions, sometimes all of our sessions are an hour or 50 minutes, and it does, I think, take at least that amount of time to be able to go over to clearly teach the technique in the coaching sessions. In terms of frequency, I mean, that is also individually driven, as it would be during your individual session. So we see some children twice a week, some, once a week. So that's based on the child's need and, of course, what can work in with the family's schedule, payments, and those aspects.
Most evidence-based parent-mediated programs that are out there where you could buy a curriculum are usually designed to meet once or sometimes twice a week for roughly an hour, usually over somewhere between like 10 and 12 weeks. So that should give you an idea for kind of these more comprehensive parent coaching programs that are either focused on social communication development or behavior management. And so I think you can actually run it very similarly to how you would do an in-person coaching program.
And then if you were delivering the individual models, though, you're shifting to still help the families, because I found those families who have maybe cycled through Project Impact or another parent-mediated intervention, they're still wanting to work towards their child's goals in practice, and having these check-in and structured sessions and giving them activities on an ongoing basis helps with that too.
Oh yes, I meant in terms of like learning learning the strategies and then that ongoing coaching. Yes. Another question that we got was sort of how long does it really take to prepare, both to prepare the family and really to get going, but also to prepare as the clinician before you actually start a session.
Right. So I mean, we were fortunate because Brooke and her lab has done research on Project Impact, and the format of a parent coaching model was pretty easy to shift over. So when we stopped, we didn't have a break in services before we shifted over to the telehealth sessions, but I think it depends on some of the structural aspects of your organization where you work that you might have to set up. But in terms of preparing, you want to, I would take the first sessions to make sure you've prepared the family so that they understand what to expect. For a lot of our families in my practice, again, they'd gone through parent coaching, so it didn't take as long. I think some were initially hesitant until it's clearly defined. So developing something within your system that can kind of define the service delivery model and the format that you can send out to families will be helpful and prepare sessions. Once you've got a child going with the program, and you've set up those parameters, like I said, it's 5 to 10 minutes to email all the information, set up the link to the family before, because you've collected some of that at the end when you've done the practice plan.
Okay. Well, thank you guys so much. Like I said, we will send a follow-up email with a link to this video that'll be posted on YouTube, a link to we'll send you along the slides and some additional resources, links that we referred to. And we wish you the absolute best as you are supporting families during this time period.
Yes, thank you. And as Brooke said, we really hope, I know families do have the need, and we hope that some of this was useful so you can continue to provide services to those families. And take care to all of you.
Thank you.